The lung primary channel originates in the middle jiao, in the region of the stomach, descends to connect with the large intestine, returns upwards to pass the cardiac orifice of the stomach and traverses the diaphragm, penetrates the lung, ascends to the throat region, passes obliquely downwards towards lung 1 where the channel emerges, ascends 1 rib space to lung 2, in the center of the hollow of the deltopectoral triangle, descends along the anterolateral aspect of the upper arm, lateral to the heart and pericardium channels, to the cubital fossa of the elbow at lung 5, passes along the anterolateral aspect of the forearm towards the styloid process of the radius, follows the lateral border of the radial artery to the wrist at lung 9, traverses the thenar eminence to terminate at the radial side of the thumbnail at lung 11. A branch separates from the main channel at lung 7, at the styloid process, and travels directly to the radial side of the tip of the index finger, where it links with the large intestine channel. The lung primary channel connects with the following zongfu: stomach, large intestine, lung. The lung primary channel meets with other channels at the points none. The large intestine primary channel begins at the radial side of the tip of the index finger, runs proximally along the radial side of the index finger, and passes through the interspace between the first and second metacarpal bones at large intestine 4. Reaches the depression between the tendons of extensor pollicis longus and brevis, where large intestine 5 is situated, continues along the lateral aspect of the forearm to the lateral aspect of the elbow at large intestine 11. Rises along the lateral aspect of the upper arm to the shoulder joint at large intestine 15. Crosses behind the shoulder to the depression between the scapular spine and the lateral extremity of the clavicle, large intestine 16. Travels in a medial direction, passing through small intestine 12 to do 14, where it meets with the other 5 young channels of the hand and foot. From do 14 it enters the supraclavicular fossa in the region of stomach 12 and connects with the lung before descending through the diaphragm to join with the large intestine. Another branch ascends from the supraclavicular fossa along the lateral aspect of the neck, passes through the cheek, and enters the lower gums. From the gums the channel passes through stomach 4, curves around the upper lip, and crosses to the opposite side of the body, do 26, at the philtrum, from do 26. The left channel travels to the right, and the right channel travels to the left to terminate either side of the nose at large intestine 20. At large intestine 20, the large intestine channel joins with the stomach channel. A branch of the large intestine primary channel descends to stomach 37. The large intestine primary channel connects with the following zongfu: large intestine, lung. The large intestine primary channel meets with other channels at the points stomach 4, stomach 12, small intestine 12, do 14, do 26, rin 24. The stomach primary channel begins at the lateral side of the nose at large intestine 20, ascends to the medial canthus where it meets the bladder channel at bladder 1, descends laterally along the infraorbital ridge to stomach 1, descends to enter the upper gum and curves to meet with do 28 and do 26. circles around the lips and meets the conception vessel at RN 24 in the mentolabial groove of the chin, runs laterally across the cheeks to stomach 5, and to stomach 6 at the angle of the mandible, ascends anterior to the ear passing via stomach 7 to gallbladder 3. Ascends within the hairline of the temporal region to stomach 8, passing via gallbladder 6, gallbladder 5, and gallbladder 4, follows the hairline to meet the governing channel at DU 24. A branch separates at stomach 5 and descends along the anterior border of the sternocleidomastoid muscle in the throat region to enter the supraclavicular fossa at stomach 12, travels posteriorly to the upper back where it meets the governing channel at DU 14, descends through the diaphragm, linking with RN 13 and RN 12 to enter the stomach and connect with the spleen. A further branch descends from stomach 12 along the mammillary line, 4-inch lateral to the midline, as far as stomach 18, then passes 2-inch lateral to the midline, and descends alongside the umbilicus to stomach 30 in the inguinal region. A further branch originates from the pyloric orifice of the stomach, descends within the abdomen, and meets with the previous portion of the channel at stomach 30. From the inguinal region at stomach 30, the channel travels laterally to stomach 31 on the anterolateral aspect of the thigh, descends along the lateral margin of the femur to the patella, and alongside the lateral margin of the tibia to the dorsum of the foot, terminating at the lateral side of the tip of the second toe at stomach 45. A further branch separates from the main channel at stomach 36, 3-inch below the knee, and terminates at the lateral aspect of the middle toe. A further branch separates on the dorsum of the foot at stomach 42 and terminates at the medial side of the tip of the big toe at spleen 1 where it links with the spleen channel. The stomach primary channel connects with the following zongfu, stomach and spleen. The stomach primary channel meets with other channels at the following points: large intestine 20, bladder 1, gallbladder 3, gallbladder 4, gallbladder 5, gallbladder 6, DU 14, DU 24, DU 26, DU 28, RN 12, RN 13, RN 24. The spleen primary channel begins at the medial side of the tip of the big toe at spleen 1, runs along the medial aspect of the foot, following the border where the skin changes color, ascends in front of the medial malleolus at spleen 5. Follows the posterior border of the tibia up the medial aspect of the leg to a 0.8-inch superior to the medial malleolus, where it crosses and travels anterior to the liver channel. Ascends along the medial aspect of the knee and the anteromedial aspect of the thigh to the lower abdomen, where it intersects the conception vessel at RN 3, RN 4, and RN 10 before entering the spleen and connecting with the stomach. Emerges in the region of the stomach and ascends first at 4-inch lateral to the midline, then at 6-inch lateral to the midline, passing through gallbladder 24, liver 14, and lung 1, and descends to terminate in the 7th intercostal space on the mid-axillary line at spleen 21. A branch ascends through the diaphragm, runs alongside the esophagus, and spreads over the lower surface of the tongue. A further branch ascends from the stomach, passes through the diaphragm, and flows to link with the heart. The spleen primary channel connects with the following zongfu: spleen, stomach, heart. The spleen primary channel meets with other channels at the following points: lung 1, gallbladder 24, liver 14, ren 3, ren 4, ren 10. The heart primary channel originates in the heart, emerges from the system of blood vessels surrounding the heart, and descends through the diaphragm to connect with the small intestine. A branch separates from the heart, ascends alongside the esophagus, and then across the face and cheek to connect with the tissues surrounding the eye. Another branch travels directly from the heart to the lung, and descends to emerge from the axilla at heart 1, then travels along the medial aspect of the upper arm, medial to the lung and pericardium channels, to the elbow at heart 3. Descends along the anteromedial aspect of the lower arm to the pisiform bone of the wrist at heart 7, travels through the palm, and along the radial side of the little finger to terminate at the radial corner of the nail at heart 9. The heart primary channel connects with the following zongfu: heart, lung, and small intestine. The heart primary channel meets with other channels at the points none. The small intestine primary channel originates at the ulnar side of the tip of the little finger at small intestine 1, ascends along the ulnar aspect of the hand to reach the wrist where it emerges at the styloid process of the ulna at small intestine 6, follows the ulna to the medial aspect of the elbow, where it passes between the olecranon of the ulna and the medial epicondyle of the humerus at small intestine 8, runs along the posterior aspect of the upper arm, intersecting the large intestine channel at larger intestine 14, to the posterior aspect of the shoulder joint at small intestine 10. Zigzags from the inferior fossa to the superior fossa of the scapula through small intestine 11 and small intestine 12, and then to the medial aspect of the scapular spine at small intestine 13. Crosses via small intestine 14 and small intestine 15 to do 14 at the lower border of the spinous process of C7, intersecting the bladder channel at bladder 41 and bladder 11, descends into the supraclavicular fossa at stomach 12 and connects with the heart, descends along the esophagus, intersects the conception vessel at ren 17 and passes through the diaphragm to the stomach, intersects the conception vessel at ren 13 and ren 12 and enters the small intestine. A branch ascends from the supraclavicular fossa to cross the neck and cheek to the outer canthus of the eye, where it meets the gallbladder channel at gallbladder 1, then travels posteriorly towards the ear, where it intersects the gallbladder channel at gallbladder 11 and the Sanjiao channel at Sanjiao 20 and Sanjiao 22 and enters the ear at small intestine 19. Another branch separates from the previous branch on the cheek and ascends to the infraorbital region, small intestine 18, then along the lateral aspect of the nose to the inner canthus where it meets with the bladder channel at bladder 1. Another branch descends to stomach 39, the lower He-Si point of the small intestine. The small intestine primary channel connects with the following zongfu: heart, stomach, and small intestine. The small intestine primary channel meets with other channels at the following points: larger intestine 14, stomach 12, ren 17, RIN 13, RIN 12, DO 14, bladder 11, bladder 41, bladder 1, gallbladder 1, gallbladder 11, Sanjiao 20, Sanjiao 22. The bladder primary channel begins at the inner canthus of the eye at bladder 1 and ascends along the forehead to the vertex to intersect with gallbladder 15, DO 24, and DO 20. From the vertex, a branch descends to the temples in the region above the ear, intersecting the gallbladder channel at points gallbladder 7, gallbladder 8, gallbladder 9, gallbladder 10, gallbladder 11, and gallbladder 12. From the vertex, another branch enters the brain, meets the governing channel at DO 17, and then emerges to descend to the nape of the neck where the channel splits into two branches. The first medial branch descends along the posterior aspect of the neck, intersecting DO 14 and DO 13, then descends alongside the spine, 1.5-inch lateral to the midline, to the lumbar region. Penetrates deep into the interior via the paravertebral muscles to connect with the kidneys and link with the bladder. A sub-branch separates in the lumbar region, descends along the sacrum, crosses the buttock, and descends to the popliteal fossa of the knee at bladder 40. The second lateral branch separates at the nape of the neck and descends to the medial border of the scapula, and then parallel to the spine, 3-inch lateral to the midline, to the gluteal region, crosses the buttock to intersect at gallbladder 30. Then descends along the posterolateral aspect of the thigh to meet with the previous branch of the channel in the popliteal fossa at bladder 40, descends through the gastrocnemius muscle, emerges posterior to the lateral malleolus at bladder 60. Then follows along the fifth metatarsal bone to terminate at bladder 67 at the lateral side of the tip of the fifth toe, where it meets with the kidney channel. The bladder primary channel connects with the following zongfu: kidneys, bladder. The bladder primary channel meets with other channels at the following points: DO 20, DO 24, gallbladder 15, gallbladder 7, gallbladder 8, gallbladder 9, gallbladder 10, gallbladder 11, gallbladder 12, DO 17, DO 14, DO 13, and gallbladder 30. The kidney primary channel begins beneath the little toe, crosses the sole of the foot to kidney 1, emerges at kidney 2, anterior and inferior to the navicular tuberosity, travels posterior to the medial malleolus at kidney 3, where it descends through the heel, and then ascends to below the medial malleolus at kidney 6, ascends along the medial aspect of the leg, intersecting the spleen channel at spleen 6, continues up the leg to the medial side of the popliteal fossa at kidney 10, and along the posteromedial aspect of the thigh to the tip of the coccyx, where it intersects with the governing vessel at DO 1, threads its way through the spine, enters the kidney and connects with the bladder, intersects the conception vessel at RIN 3, RIN 4, and RIN 7. One branch emerges from the kidney, ascends through the liver and diaphragm, enters the lung, and ascends along the throat to terminate at the root of the tongue. Another branch separates in the lung, joins with the heart, and disperses in the chest to link with the pericardium channel and RIN 17. The kidney primary channel connects with the following zongfu: kidney, bladder, liver, lung, heart. The kidney primary channel meets with other channels at the following points: spleen 6, do 1, rin 3, rin 4, rin 7, rin 17. The pericardium primary channel originates in the center of the chest, connects with the pericardium, and descends through the diaphragm to the abdomen, passing through the upper, middle, and lower jiao. One branch runs from inside the chest to emerge in the costal region 3 inch inferior to the anterior axillary fold, near pericardium 1, arches over the axilla, and follows along the anteromedial aspect of the upper arm, between the lung and heart channels to the cubital fossa of the elbow at pericardium 3. Descends the forearm between the tendons of the palmaris longus and flexor carpi radialis muscles to reach the palm at pericardium 8. Travels from the palm along the middle finger to terminate at its tip at pericardium 9. Another branch arises from the palm at pericardium 8 and follows the radial aspect of the ring finger to its tip. The pericardium primary channel connects with the following zongfu, sanjiao. The pericardium primary channel meets with other channels at points, none. The sanjiao primary channel begins at the ulnar aspect of the tip of the ring finger and runs between the 4th and 5th metacarpal bones along the dorsum of the hand, travels up the posterior aspect of the forearm between the radius and the ulna, and between the large and small intestine channels. Traverses the olecranon of the ulna at sanjiao 10, and continues up the posterolateral aspect of the upper arm to the shoulder, where it intersects the small intestine channel at small intestine 12, travels towards the spine via bladder 11, where it intersects the governing vessel at do 14. Ascends laterally to the highest point of the shoulder, where it intersects the gallbladder channel at gallbladder 21, descends anteriorly into the supraclavicular fossa at stomach 12, then disperses midway between the breasts at rin 17. Connects with the pericardium, then descends through the diaphragm to the abdomen via rin 12, linking along its pathway the upper, middle, and lower jiao. A branch of the channel separates in the region of rin 17, ascends to emerge from the supraclavicular fossa, rises along the neck to the posterior aspect of the ear, circles behind the ear via gallbladder 11 to the temples, where it intersects the gallbladder channel at gallbladder 6, gallbladder 5, gallbladder 4, and gallbladder 14, winds down across the cheek, intersecting the small intestine channel at small intestine 18, ascends to the inferior aspect of the eye. Another branch separates behind the ear and enters the ear, emerges in front of the ear to intersect the small intestine and gallbladder channels at small intestine 19 and gallbladder 3, crosses the previous branch on the cheek to terminate at the outer canthus of the eye at sanjiao 23. Linking with gallbladder 1. A branch of the sanjiao primary channel descends to bladder 39. The sanjiao primary channel connects with the following zongfu, sanjiao, upper, middle, and lower jiao. Pericardium. The sanjiao primary channel meets with other channels at the following points: small intestine 12, bladder 11, do 14, gallbladder 21, stomach 12, RIN 17, RIN 12. Gallbladder 11, gallbladder 6, gallbladder 5, gallbladder 4. Gallbladder 14, small intestine 18, small intestine 19. Gallbladder 3, gallbladder 1. The gallbladder primary channel begins near the outer canthus of the eye at gallbladder 1, crosses to the anterior portion of the ear at gallbladder 2, then ascends to the upper border of the zygomatic arch at gallbladder 3, ascends to the corner of the forehead at gallbladder 4, and descends via points gallbladder 5. Gallbladder 6 and gallbladder 7 to the region above the ear, where it meets with Sanjiao 22, curves posteriorly behind the ear to the mastoid process at gallbladder 12, meeting with Sanjiao 20. On the way, curves upwards across the side of the head to the corner of the forehead at stomach 8, and descends to the supraorbital region at gallbladder 14, ascends and curves across the side of the head to gallbladder 20 below the occiput. Crosses the top of the shoulder via gallbladder 21 and Xianjiao 15 to meet with the spine, Du 14, passes laterally via bladder 11 to small intestine 12, then anteriorly to enter the supraclavicular fossa at stomach 12. A branch emerges behind the ear and enters the ear at Sanjiao 17. Emerges in front of the ear and passes via small intestine 19 and stomach 7 to the outer canthus. Descends to the corner of the jaw near stomach 5. Crosses the Sanjiao channel and rises to the infraorbital region and meets with bladder 1. Descends to the neck, passing near stomach 6 and intersecting stomach 9 to rejoin the main channel in the supraclavicular fossa, descends into the chest, meeting with the pericardium channel at pericardium 1, crosses the diaphragm, connects with the liver, and unites with the gallbladder. Continues along the inside of the ribs to emerge in the inguinal region. Encircles the genitals, runs superficially along the margin of the pubic hair, then enters deeply to emerge at the sacral region where it meets the bladder channel at Baoliao, the 4 points of the sacral foramina, and the governing vessel at Du 1, emerges on the buttock at gallbladder 30. Another branch descends from the supraclavicular fossa to the anterior aspect of the axilla, then passes through gallbladder 22, gallbladder 23, and gallbladder 24, intersects the liver channel at liver 13. Descends to the hip joint to meet the previous branch at gallbladder 30, and continues down the lateral aspect of the thigh and knee. Descends along the lateral aspect of the lower leg to the anterior aspect of the lateral malleolus. Follows the dorsal surface of the foot along the groove between the 4th and 5th metatarsals to end on the lateral side of the tip of the 4th toe at gallbladder 44. Another branch separates on the foot at gallbladder 41 and runs between the 1st and 2nd metatarsal bones to the medial tip of the big toe, then through the toenail to link with the liver channel. The gallbladder primary channel connects with the following zongfu, gallbladder and liver. The gallbladder primary channel meets with other channels at the following points: stomach 7, stomach 8, stomach 9, stomach 12, small intestine 12, small intestine 19, bladder 1, bladder 11, bladder 31, bladder 32, bladder 33, bladder 34. Pericardium 1. Sanjiao 15. Sanjiao 17. Sanjiao 20, Sanjiao 22. Liver 13. Do 1, Do 14. The liver primary channel originates at the lateral aspect of the dorsum of the big toe at liver 1 and runs along the foot to liver 4, 1 inch anterior to the medial malleolus, ascends along the medial aspect of the lower leg, intersecting the spleen channel at spleen 6, then continues to ascend anterior to the spleen channel to an area 8 inch above the medial malleolus, where it crosses and continues posterior to the spleen channel up to the knee and the medial aspect of the thigh. Continues to the pubic region via spleen 12 and spleen 13, where it encircles the genitals, then ascends to enter the lower abdomen where it intersects the conception vessel at Rin 2, Rin 3, and Rin 4. Continues upwards to curve round the stomach before entering the liver and connecting with the gallbladder. Crosses the diaphragm and spreads in the costal and hypochondriac region, ascends along the neck and posterior aspect of the throat to the nasopharynx to link with the tissues surrounding the eye, ascends across the forehead to the vertex where it intersects with the governing vessel at Do 20. A branch descends from the eye system through the cheek and encircles the inner surface of the lips. Another branch separates from the liver, crosses the diaphragm and spreads in the lung, meeting with pericardium 1. The liver primary channel connects with the following zongfu: liver, gallbladder, lung, stomach. The liver primary channel meets with other channels at the following points: spleen 6, spleen 12, spleen 13, Rin 2, Rin 3, Rin 4. Pericardium 1. Do 20.